Welcome to Little Spark Big Impact Podcast. I'm your co-host, Mica Mitchell, and I'm here with our other co-host, Joe Schreiber. And as pediatric providers, we play a pivotal role in a child's development. We educate the support system that empowers caregivers, and we celebrate every victory, no matter how small. Each episode of this podcast will dive into different topics and the latest research to help you make an even bigger impact with those you work with. Whether you're a seasoned professional or just starting out, this podcast will hopefully give you ideas to support the positive impact you can have on the lives of the children and caregivers that you have an opportunity to work with. Our goal is to spark deeper thinking, reflection, and learning from each episode. Today's episode, we will be discussing social determinants of health. And so, Joe, get us started in this conversation. What comes to mind when we say social determinants of health? What does that mean to you, and what should it mean to other pediatric providers?
It's a really interesting question and something that I have sort of gradually evolved and learned much more about, especially over the last, 5 or 6 or 7 or 8 years. But it really, I think, reflects how impactful the other aspects of the child's life is beyond what we do with our physical therapy interventions in the sessions and with our efforts at caregiver education and home programs and things like that are all really important, of course. But when you think about that in the context of all the other aspects of a child's life, a family's life, really of all of our lives, it's a relatively small piece or maybe a relatively smaller impact. And the social determinants of health are all the other impacts that also have a pretty significant or substantial impact or impact, I guess is the best word for the child's health. That things like having enough food and having the opportunity to sleep in a regular schedule with getting good sleep and having access to other types of health care when necessary, needed, and both at the for the child and for the family and caregiver. And certainly that speaks to the lived environment, the home, the sort of stability of the home, the stability of the neighborhood, and what's accessible there. So it's I'm going on here because there's so much, and it's really a lot to think about. And I think in the old days, maybe we sort of set that aside and didn't really think of that as something that was in our scope of practice. And I think we're evolving to realize that it really is, and we need to focus on it much more than we have.
Absolutely. You talk about that evolution, and I think that's key, which is why we're here. We're trying to spark ideas to continue to evolve and change, and going from truly strictly medical model into this biopsychosocial, and just knowing the impact of these social things in our lives. And I think as a provider, you would think that my expertise is so important in the life of this child with an impairment, with a something that they can't do, that I'm here to help them with. But if we don't address those social things in their lives, not that we address them individually, but if it's not addressed in their lives, what I bring, my expertise, it really won't have any impact. And I think as providers, we have to kind of yield to that and be okay with stepping back and saying, you know what, maybe my expertise in physical therapy is not what you need right now because you don't have food, right? What does that mean in the life of a child that is hungry, right? If you're hungry, hangry, at the point of malnourished, the physical therapy, these developmental milestones, you're probably not going to meet them because we haven't addressed your nutrition. Why is it that you don't have the food that you need, with no judgment? And I think that's part of it too. And I think that's definitely a part of this conversation, because a lot of times the marginalized in our societies are those that are negatively impacted by the social determinants of health and how policy is structured, or how their living environments are set up, where there aren't options for the marginalized.
Mhm.
There's not options for those that have been discriminated in these areas where they can't make improvements. And I think you started talking about, what are some of these social determinants, and I think it's our job to know what are they,
Mm.
and to know what they are where I live,
Mhm.
and then to figure out like how can I what can I do about it?
Right.
Mm,
Yeah, that's I'm curious too. So one of the things that perhaps can get at that is a screening, like a social needs screening, some sort of
Absolutely.
form or document. I wonder, I don't if you've used those, or and to to your point, I think is it's great to use them. But if we don't connect with the follow-up, if there are issues are that emerge, then it's really pointless, or almost could have a negative impact, because we're
Absolutely.
drawing these issues to the surface, but then not really doing much about them. So I wonder if you had much experience with that, or
Yeah, so that's a great point, right? The disclaimer is before you even ask about these social determinants of health, before you ask about, consider giving a social needs screening, if you have no resources, no opportunities to connect them to the things that are pain points maybe in their lives, it may be better for you not to actively screen, because there's a false hope, or maybe there is just more a compounding impact of I got to tell the story one more time to somebody that
Mhm,
can't help me. And
mhm,
so social needs screens, formally and informally, absolutely. Listening to the caregivers, observing in the environment as to what's going on and what might be lacking and missing. And then past history, past experiences, like for myself as a provider. So yes, there are formal social needs screens that absolutely should be maybe implemented somehow into your workflow of either at evaluation, or during after we get to know each other, maybe at follow-up appointments. There's informal ways to kind of talk as to maybe the things that you observe, right? Because we see all types of things as pediatric providers. Some things we speak about, some things we don't, but being kind and curious, I think, will allow you to connect with individuals that they would feel comfortable to share. And so, in an informal way, if I notice that, what, this baby has had a diaper on that is just really full, and the family's really not interested in changing it, right? So asking like, do you have enough diapers, right? Do you have enough food? And because I know that I'm not going to ask this question without a resource, being able to then say, let me tell you about what's available in our area, or here's this resource where you can touch base with social worker, or this community program that supports, young growing children.
yeah,
And so for that, you have to get connected to the social scene. And I would say not so much where you live, but where you work, where your, what spaces your patients are,
yep,
so that it's not a drain on them even the more to say, oh, well, you have to go to a different side of town or a different part of this area to get what you need. It's on us to figure out what is there and available for them.
yeah.
What about you?
Yeah, as you're talking like that, that conversation is a little bit fraught, right? Because you don't want to come across as judgmental. You don't want to come across as demeaning, or
Mm-hmm.
uh, so uh, I, I'm like the you mentioned kind of kind, friendly. That idea of a therapeutic alliance, building a relationship, a rapport with families,
Absolutely.
from day one is really an important part of that, or important piece of that, so that there is a level of trust or comfort that families can engage with them. I was kind of scrolling through. Have some of my notes up and things like that from different presentations. Like, what is the phrasing? Like, if you're
Mm.
approaching a maybe a difficult subject, or you know um asking, like, so for example, it's my understanding, like, asking, "Are you okay?" Maybe
Mhm.
it's puts people a little bit on the defensive, or is not maybe the best, because then they sort of have to compare themselves to the rest of the universe and decide, am I okay, or
Right.
I'm not okay? How, well, versus, maybe, I'm noticing that you've come in late a couple times. I wonder if is there anything going on there, or probably
Mhm.
not the best way to phrase it either. But again, like
But
that.
that's a great I feel like that we definitely need to dive into that one, right? Because as pediatric providers, we will have patients show up late or patients no show,
Yeah,
right? And how you address that, how you if you don't
right,
handle that with the care, you potentially lost your patient. You can't even dig a little bit deeper and see, are you curious enough to ask them
yeah,
why they were late in a way that can disarm it, not,
right,
once
right,
again, are you being kind about it, or are you upset because it's affecting your productivity? Are you upset because, you had other things to do? But
mm,
to this family, sometimes people do everything they can to come to you, and I've seen it, and I've seen it backfire where it's like, well, just because there's a lot going on, from my perspective, I can't bring all of that heaviness to this interaction because you have no idea why they were late, right? Yes,
right,
you have outliers that are just late because for late's sake, but you just err on the side of you just don't know. And so how do we approach that? How do we approach no-shows?
yeah,
And those policies, right? Part of social determinants of health is these
uh-huh,
policies that are in place.
right,
You miss 3 times, you're done.
right, right, right.
Is that
Well,
kind?
yeah, I mean, the challenge
And
on the
kind
other
to
side.
who? Kind to who?
Yeah, I think the response to that, from a business owner perspective, is we're not
Mhm.
getting reimbursed
Mhm.
so it's hard for us to have, the
Mhm.
business continue if we don't have, sessions that are scheduled, that are occurring. So I
Mhm.
but there are ways to navigate that, or
Absolutely.
support that, and
Absolutely. Like, the cop out is not acceptable,
right,
from a
exactly,
business standpoint. Guess what? Policies there could be even and you have a policy for cancellations, might need a policy to check in on people as to why they're late, right? Like, I think you should have a counter for each if you have a
yeah,
policy that's gonna have a negative impact, you absolutely should have a policy and a plan to connect with these humans because if you do that well,
yeah,
long term, that won't be an issue.
yeah. Yeah, if you again approach it from a place of kindness and, uh, curiosity, or
Mhm. With resources.
empathy, yeah, and open-ended types of questions,
Mhm,
not, "You were late for 3 times, and our policy
mhm,
is, and I'm sorry, but,"
mhm. Sorry,
versus,
not sorry.
what can we how can we
Mhm.
work together, to
Absolutely.
get your child the services that they need,
Mhm,
and then sort of let it go and
mhm,
see where the
mhm.
conversation leads, and continue to engage with the families that way. I think that makes a lot of
And I
sense.
think yeah, I think that's important too because in that conversation, maybe we come to the agreement that right now is not the time for PT.
Yeah,
But is a way to do that collaboratively for the family to say, "You know what? This is really hard for me. I'm doing everything I can to make this particular time that might be the only time that's open in
right.
in the schedule or that they even can think they can get there." And I think that's then for us to say, "You know what? Let's just take a pause. Let's come back when you have
Mhm.
more options or when these other social needs are being met in a different way
Yeah,
that help allow you to be successful. And in the meantime, here are some resources, or maybe there's another provider or federal programming that depending on the age of the child that they can still partake and get their needs met. But I think being okay with letting go, because I am a firm believer, like, if it pertains to business, right? Like, oh, but I have to keep patients because that's revenue. Well, guess what? If you release that in a kind way, in a way that supports your community, which includes the people that live there, it'll come back in a better way for you and open up space for someone that also needs therapy.
Yeah.
And then you have this process that could be so much kinder than policy
Mhm.
implement, period. It goes back
Mhm.
to
Mhm.
how do you build that alliance that you talked about?
Yeah. I put a resource in the chat. I know we're gonna try to
Mhm.
give people access to these, but
Mhm.
uh, this is something that was shared in a course that we offered through
Mhm.
PT Learning for Practice, and we're actually offering again in a few months here on just on this topic, social determinants of health, and it's called a
Mhm.
neighborhood navigator.
Yes.
And I don't know if you're familiar with it, Mika, but
Yes.
it's
Yeah.
you go to this website and then plug in your zip code or whatever zip code wherever the family lives, and then various resources related to social determinants of health
Mhm.
are identified. And so that, I think that speaks a little bit to the what we were talking about in terms of like a social needs screen, but without
Mhm.
without follow up. So this does help with a follow-up and then building your own knowledge about the resources, the community organizations that are available where you work, as you said, and where your families are living,
Mhm.
and perhaps creating some actual hard copy types of resources or things that families can use, phone numbers, things like that, that
Mhm.
might be supportive if either through the screening or through the conversations that you have with families as you get to know them, that you can share, or you can even just share these in a brochure in the waiting room, or as a
Absolutely.
family resource page somewhere, a family resource bulletin board, so it doesn't have to be that you and the family talk about how they're having some food insecurity issues or whatever. They don't have to have that
Right.
conversation with you. They can just see on the bulletin board,
Mhm.
here's a number for a food bank or wherever that can help with that. So
Yeah.
and that might get people started at least in having the resources available that can get at some of these challenges.
Yeah, and I think normalizing this, right? Like, normalizing what else could help you
Hmm. Yeah.
improve? Like, where else do you see that you have needs that are unmet? We need to approach this from the whole body, right? We as physical therapists, we do these multi-systems assessments, right? So the
Hmm.
same thing for the life of a human, and the little ones that we serve as well. And I think normalizing, hey, if you have a need, more than likely there's a resource. And so, yes, I like that site is great. I
Yeah.
use findhelp.org, and that's
Oh,
another
okay.
resource that we can share. And it's the
Hmm.
same process. You put in your zip code, and then that allows people to put, if their zip code is a little bit, different from where you are, you can say, hey, put in a zip code, and then it opens up all these social need resources that people can take the time on their own time to filter through and see, you know what, maybe I had no idea that th- I could get assistance for a legal concern that I'm having that's
Sure.
impacting my housing,
Sure.
that's impacting,
Yeah.
my ability to make my doctor's appointments. And so just seeing what's there, because, we're not well versed in all of this,
Yeah.
but allowing someone else to have a resource that they can, on their
Yeah.
own time, go
Yeah.
through and see how much even the more is there than we potentially knew. Like, "Oh, wow, that's
Yes.
fantastic." And
Yeah.
like you said, you may not wanna share everything.
Yeah, I love that because you said earlier to have to tell my story again or talk about this again or whatever, versus here's a resource booklet that all our families get. Not
Absolutely.
That's an important point, right? Because I think
Yes.
we have to be careful with our
Yes.
biases that
Oh gosh,
only these
don't
people
single
may.
out one or the other. It's all
Yeah,
or
right.
none for
Yeah.
sure.
So all families get this resource booklet that has local community resources, just like what we're saying, in a hard copy. And then if they do have email or they're able to get to a website, it can be on your clinic site
Mhm.
website that people can, easily get to. And there's that whole like implicit, the implied, like if it's like an afterthought or not everybody gets it, or you pull it out just when you see the dirty diaper or that sort of
Mhm.
thing,
Mhm.
versus here's a resource, and then
Yeah.
it's updated periodically. It lives, right. It's a substantial type of thing that all families get, like, then maybe that provides. And if a conversation does arise or emerge, then you have that, and you can either pull it up on the website, or pull out the hard copy and circle or highlight some organizations, that so that you're not, like I said, it's fraught. Like, you see a baby that has a diaper, and, like, yeah, it's just a bad day, and I didn't get you, or maybe we
Mhm.
were just rushing out, and so
Absolutely.
there's not maybe a significant issue with not having enough diapers. It's just a bad day, but our sometimes our assumptions go down a road that can be fraught, or problematic, especially if
Mhm.
it comes from a place of, like, judgment, or sort of finger wagging, so.
Yeah, or even if you're not aware of it, like the signs may be in front of you and you have no idea, right? So, which is why if you normalize this from the beginning, you have rapport, you can, we shared this before, but let me, have you had a chance to look at this? Are there any of those resources that are beneficial to you? I think, as you are able to, if you're in a situation where you don't feel comfortable to have this conversation. And I think part of this discussion is like, this is an evolution even within your interpersonal and your interrelational abilities with other humans. So if this is the first time you're hearing this, or this is the first time that you're being introduced to this concept or these ideas or these screenings and these resources, and you're not sure how to bring it up, you got to take baby steps, right?
Mhm,
And each time it'll get a little bit easier. You'll find your words. You'll see how this is impacting people in a way that, like, I had no idea, didn't even know.
mhm, mhm,
And so I think just giving yourself that permission as a provider to say, you know what, I was not even aware of any of this,
mhm,
but how can I implement this, right? Like, what do I do now? I take small steps, right? Don't try to throw everything at one time because you want it to seem, you want it to be genuine.
mhm. Yeah, definitely. Yeah, I mean, I said, thought about this a lot more in the last 5 or 6 or 7 years, or whatever it is, and that's the truth. This was not a
Mhm.
part of my sort of standard clinical practice considerations or factors. I was totally zeroed in on impairments, activity, and to much lesser extent the participation, which is kind of what this is at that level of participation. How well can kids and families, engage in their communities, and in doing the things that families and children do? And if you're challenged with some of these other social determinants that are maybe suboptimal for you as a family, then you can't do, like, the good stuff of participating as well as we would like. So I sort of evolved and think a lot more about participation, but embedded in that now is really that sort of additional layer or aspect that we all need to be thinking about. And the other thing, the framing too, like, so there's sort of downstream, midstream, and upstream. And I think of downstream is that sort of interaction that we've been talking about, the interaction on a one-to-one level. And then midstream is sort of connected with that, the policies. We talked about the cancellation policies and the things that are policies in your organization, or sometimes in the profession, they're professional. And then the upstream is really kind of, I think, bigger picture societal. And if you think about all those different layers, and for me, again, the kind of the evolution, uh, trying to think about each of those and what I can do as an individual, and as a member of an organization, as a good citizen, to try to address these. So it's definitely been a big improvement for me in terms of, I think, my sort of attention to all this over the past, like I said, 5, 6, 7 years or so, maybe a little bit longer, but, it's definitely improved. So,
Yeah, and I think that's like so beautifully stated. Sharing that story, right? Being okay with saying, like, guess what? It wasn't on our radar when I first got out of school. No, like you said, we're addressing this medical issue, this concern that we have.
mhm,
But in addition to addressing the impairment, working on the goals, the participation, the function, this layered in just will make a world of a difference in the lives of those that we're working with. And I think, when I think about what could we do to address social determinants of health in a more impactful way, um, knowing what we know as we have progressed in our careers as individuals and then collectively, I think just really expanding your awareness to what these are, and how they impact your local community, and then where are you willing to speak truth to power to injustices that you see?
mhm,
What is your level of just motivation to
mm,
try to have this implemented in the care of all of those that you're working with in a way that we're not singling anyone out, we're not um, acting out our biases
mm,
that exist, but
right,
we are truly doing our self-work on identifying, you know what? How can I be a more of an advocate for those that are marginalized, those that are at risk of being negatively impacted by social determinants of health? What can I do? And then really find you an accountability partner or share with this little spark big impact community and say, this is what I want to do. This is what I'm going to do. This is what I would like to try. And looking for those other individuals that have
mm,
that same desire, because
yeah,
that's how you then continue to make the impact, right? You can make an impact on an individual level, but how do we make this greater impact, and then change that paradigm shift? Because I think some of this too, we talk about social determinants of health and like where people live, and I know I've seen it as providers where there are some places that providers are like, well, I'm not going to go there to provide care.
yeah,
Well, you have all this knowledge and you have the ability to connect people to social needs and resources, but you don't want to go somewhere to an area that you perceive or that is in your geographic area, um, considered undesirable.
mm,
And so we're then, what harm is continuing to happen because we're not willing to say, you know what, it doesn't matter. I'm going to go into this space, right? And provide care and help this family and connect them, share the resources, right? Because we
yeah,
can't make anybody partake, but at
mhm,
least we know we have shared and said, look, these resources, maybe someone has to hear something multiple times for them to truly receive it and say, okay, you know what, I will reach out. Oh, I've heard about that from my doctor's office, from my OT provider, from my SLP provider, from my P. Everybody keeps bringing up this webpage. You know what? Okay, fine. I'll go visit it.
mm,
Right.
yeah,
Like those are the things. Like, do you have the fortitude to stick with it if the first time you share it, it's not well received? Are you
yeah,
gonna be offended or are you gonna say, guess what? How many
mm,
times? How many more times?
yeah, yeah, yeah. Yeah, it's a great point, to the sort of persistence, because it is a little bit outside of our comfort zones,
Absolutely.
and so that, and then if you have, a community of like-minded individuals, so sometimes that's one other person, sometimes it's a few people, in your clinic or your colleagues or whoever, uh, that can, as you said, like, support, but also hold accountable for actually making changes. I think those are great points, great ideas. I know, I know you have a continuing education course. I just wanted to plug too for the PT Learning for Practice, the Social Determinants of Health course. It's going to start in June. Registration's open. It's on the website, and it addresses just what you're saying in terms of building a community, because it's very much designed around conversations, discussion, interaction, and there's a capstone project, so there's a little bit of work, a little bit of homework, but the expectation really is that you take the information, really think about it, and apply it. So there's multiple, 3 or 4 sessions over 3 or 4 months, meet and talk about different things, and then in between, allow you some time to reflect and learn, a little bit of a spark, and then reflect and learn and apply, and then come back and talk about it. So if you're interested in something like that, I would encourage you to go ahead and check that out. And Mika, I know you have something coming up too, related to this.
Yeah. So what I will say to your to your continuing education course, super exciting because sometimes we need to have like a little push behind us to do the work, right? So like,
Mhm.
hey, you're signing up for this course, you're gonna put the effort into it. And I think there's value in that as well because maybe you listen to this podcast, you dive into these resources and this information, but then the people around you aren't willing or able or yet ready to go with you.
Mm.
You can join that community
Right.
and still have growth because in all of this we are lifelong learners, and if you're not willing to receive new information, process it, and do something about it, then our patients are not going to get the best and we will still be behind in meeting their needs. And yes, I do have a course that I will be offering um, to a component of physical therapy community. But it's something that, if you reach out to me, I absolutely can customize it for different organizations as well. But it's really about, looking at social needs and diving a little bit more into the social needs screenings. How do you find what is trending? That's
Mhm.
a popular, what's trending in your area? How do you
Mhm.
find what that is? And then how do you address it?
Yeah.
Because a resource, a question without a resource is harmful. And I think, to kind of wrap this up, it's that social determinants of health. This is 80 to 85% of what's going on with your patient, and your medical um, impact, diagnosis, or disorder is about 20 to 25% of what's going to help them to get better. So
Right.
if we give it just the attention for every patient, some attention toward this, how much better will our patients actually be? And it will have more of an impact than us putting the blinders on and just going in for this is the medical reason why you're here. So I challenge everybody to really consider implementing how do you impact the social determinants of health in the lives of those individuals that we work with.
Not agree more.
All right. Well, thank you for joining this episode of Little Spark Big Impact. And hopefully, our goal is that you will hear something that will really make you think about maybe do I need to change what I'm doing or can I do this in a different way? So, our goal is to spark deeper thinking, reflecting, and learning from each episode. And we hope that you did that today. Join us for our next episode. Thanks for joining.